The following is a paid program. The content within this program is not endorsed by KRCR or its affiliates. You're watching North State Health, the North State's first local health program.
Good afternoon, I'm Tim Mapes. Thank you for joining us for North State Health, the only show dedicated to bringing you the information you need to live a healthier and happier life. Our guest today is Dr. Thomas Bay, board-certified radiologist at MD Imaging in Reading. Dr. Bay, thank you for joining us today. First off, before we get into the meat of our program, let's start by you telling us a little bit about yourself and what brought you to the North State.
I'm from Detroit, Michigan originally, and I'm an outdoors person, love cycling, and I don't think there's a better place than Redding, California.
No.
I really don't.
Yeah, a lot of people feel that way, and we're glad to have you here today. Dr. Bay, you specialize in interventional radiology. Now, before we delve in, take a minute to explain to our viewers what exactly that is.
Okay, interventional radiology, it's a unique specialty. It's relatively new. The founding father of our specialty was Charles Dotter, who in 1964 invented the first angioplasty. And when people hear the word angioplasty, many think of cardiac angioplasty, because that's the most common procedure now for angioplasty. However, Dr. Dotter invented it in 1964, fully 13 years before the first cardiac angioplasty, interestingly enough. He was nominated for the Nobel Prize, one of the nominees in medicine, in 1978. So we're really proud of Dr. Dotter. He's from Portland, just 7.5 hours north of here. He passed away a little bit ago, but he was the founder of our field. Our field is more of a doctor's type field, meaning surgeons tend to call upon us to help them decrease the hospital stay on a patient. And a couple of good examples are, everyone knows someone who might have had a gallbladder removed or an appendix removed. They carry about a 1% chance of getting an infection or an abscess. The way to treat that before our field existed would be another surgery procedure, which is high risk. Now what we do is we use a thing called a pigtail catheter. A pigtail catheter is nothing more than a floppy catheter with numerous side holes on it. And here's an example on your screen, and I have one here. The pigtail catheter itself is very floppy. Getting this into the right area in the patient to drain an abscess is very important. They can be left with this for about a week or so, and after that period of time, we remove it, and they've saved themselves having to do a second surgery procedure.
And that definitely gets the patient out of the hospital sooner. It's, like you said, less invasive and less painful, which is all things that definitely you want to hear when you're a patient.
We want the patient, and our goal, our success would be to leave them with nothing more than a Band-Aid, literally, instead of another surgical incision at that site.
Okay, well, we'd like to hear that, definitely, Doctor. Well, this is not a one-man show, though, at MD Imaging. Dr. Bay, you work with a team of radiologists in your department, is that right?
I do work with a team of radiologists. We have 4 of us total in the North State. This shows to the far left of the screen, Dr. Bickmore, then myself, Dr. Hofkin, and to the far right is Dr. Chin. We've all been here at least 12 years or more, and very proud of my partners. We all have our separate subspecialties within IR, but we actually do all of the main procedures of IR. Another thing we tend to do, which is very common, is biopsies. Now, biopsies are a procedure whereby a diagnosis of cancer can occur just by doing a chest x-ray to show a mass. This is a good example here. In the upper left-hand corner of this picture is the patient who has a round white area, and that is a tumor. Whether it's benign or malignant is unknown at this point, so the requesting physician would ask us to do a biopsy, and we do that by a CAT scan. Here is a needle that we guide past any vital structure and into the tumor. We take a mini biopsy of this, and often that is enough to diagnose a cancer. The patient is again left with nothing more than a Band-Aid. In the olden days, years ago, the patient would have had possibly an entire lobectomy if they had a tumor. Now they go home the same day with a Band-Aid usually. So we're very proud of that aspect of our field.
Yeah, we love modern medicine. I mean, it just keeps getting better and better every year. It's amazing. Now, you also treat problems with veins that a lot of people have problems with, and go ahead and talk about that specialty.
Varicose veins is an exciting field and a subset of what we do, and the reason why is varicose veins are so common. You see an example here of a patient with very large ropey varicose veins, and there's some other pictures that's showing different sizes of varicose veins in different patients. But basically, a varicose vein occurs when the valves in someone's venous system stop working well. And what do I mean by that? Well, I have a picture of a valve that is working and one that is not working. When the valves stop working, what we're left with, and you can see the picture here, is a flow of blood back down the leg. The image to the right shows valves that are not functioning. What does that lead to? It leads to the vessel distending and elongating. And here's an example here. To your left on that image is a normal vein, and to your right is actually a varicose vein with blood going in both directions. I like to tell my patients an example of this using a balloon, and if I can, I'll show you a balloon little prop here. I like to show my patients. What this is just a clown balloon. But basically, if you look at this balloon, what do you see? You see it's very small at the top, and at the bottom, it's distended. Okay, so when we have that appearance, it's called a hydrostatic pressure or a fluid column. And what happens is people's veins will distend in their legs if they stand all day. An occupational hazard is surgeons and nurses who have to stand all day tend to get varicose veins unless they wear compression stockings, and we'll go into that. But basically, if you introduce valves that are functional, and if you turn this, that's a functional valve, you notice the diameter or the width of this goes down. And that's what we have. By a functional valve creates a normal vessel. Dysfunctional valves create a distension like this. So I like to tell the patients examples of that.
How painful are those? Is this situation or this symptom that these people have? I mean, is it something that's just cosmetic, or is it something that they're going to notice that it feels wrong?
They will definitely feel the symptoms of this. First of all, they're very common in terms of what we said is 1 in every 4 females can develop these in their lifetime. 1 in every 7 males, extremely common. And the symptoms: aching, pressure, burning, throbbing, itching, and even some people describe the restless leg type symptoms, whereby they just can't get comfortable laying in bed. So it's a very common problem. The problem of not treating them can lead to hyperpigmentation or an increased discoloration of the skin. And what that is actually an internal tattoo. The hemosiderin or iron in everyone's blood sits so long and deposits in the skin of these patients in their legs, and you'll see them in the lower ankle area. You'll see a brown discoloration. That's permanent. That's a permanent tattoo. Other problems are ulcerations that occur. This is an example of hyperpigmentation. The patient's image to the left is their right leg that shows the hyperpigmentation, and on the other leg, it's the changes haven't yet occurred. But we see ulcerations. So what we try to do is stop that process from getting worse by treating the varicose vein.
All right. Well, we are not done with this by a long shot. We're going to talk more about that coming up in the segments to come. We still have a lot more to get to here on North State Health. Coming up, we'll have more on varicose veins, including some of the better treatments that are available. Plus, we will delve into what may be causing that aching pain in your back. A lot of people have that, so stay with us. For more information on today's topic or any edition of North State Health, go to our website. That is krcrtv.com/NorthStateHealth. You can watch today's episode in its entirety from your computer or laptop. Stay with us.
It's your favorite piece. It's been in the family for years. Let us help it stay around for more. Bringing beauty back, one piece at a time. American Furniture Company, 241-4949.
I consider myself the face of MD Imaging because I am the first person the patients see when they come through the doors. When patients come in, they are stressed or in pain, and it is so important to me to help them feel more comfortable and at ease. The difference at MD Imaging is the compassion, care, and concern we have for our patients.
Monday. For the first time, bachelors and bachelorettes will be competing with the people who love The Bachelor the most, the super fans.
Can we just give you a little kiss on the cheek? Interesting.
Bachelor Pad, season premiere Monday, 8/7 Central on ABC.
Welcome back to North State Health, the North State's first local health program.
Welcome back. We've been talking about varicose veins and other vein diseases, and one of the big questions, doctor, how common are these conditions?
Oh boy, they're very common, especially in ladies. 1 in every 4 ladies will develop varicose veins in her lifetime. 1 in every 7 males, 15% of males literally develop these as well. So when I talk about how common they are, the main thing is who's predisposed to these? Well, predisposition factors. But one is, the main thing is aging, standing or sitting too long. Any occupation that involves sitting or standing for extended periods of time. By that I mean greater than 2 hours without moving. Any person who had a prior blood clot in their leg. Multiple pregnancies or hormonal changes, injuries, heavy-set patients. Obesity can add to increased pressure in the legs. And the main problem is family history. If your mother had these, or father had these, there's a good chance you'll have them as well, regardless of what you do. So that's a very common predispositions. Now, what happens when you get these? What kind of symptoms are you likely to have and encounter? Symptoms. One is pain, or pressure, aching, swelling, throbbing, heaviness. Many people describe a, quote, restless leg type symptom. And it's not necessarily restless leg, but it's similar type of irritation. Patients just cannot have their legs comfortable when they lay in bed. So those are the real problems. Doing nothing to these can lead to ulcerations and hyperpigmentation. But
okay. Well, so somebody has those symptoms. They're predisposed to it. Their family may have it. Bottom line is, how do you treat it?
How do you treat them? There are different ways to treat these, but in terms of varicose veins, the main thing we try to do, and from this image you can see here, we go into the dilated vein internally, and we use a heat source, either a laser or radiofrequency fiber. We offer both techniques. Radiofrequency fiber, the analogy might be a curling iron heat. That's electric heat. The laser heat is different. It's a light heat energy, but both involve heating from within and pulling that fiber back slowly to essentially, from within, collapse the vessel, collapse the bad vein. So that's a method of treating. And I think my next slide will show some pre and post after these treatments. What we can see is significant reduction in the size of these bulging veins with just one treatment. And this is about 2 weeks after. Sometimes there's residual bulging veins. And how do we treat that? That goes into the second form of treatment, and that's called ambulatory phlebectomy. Here's a good example of what we do. We make micro incisions along the skin, and we literally pull out the segments of the vein that are affecting the patient. And we can see it here. Here's an example of taking that small vein segment out through a small incision, and what we leave the patient with is much less bulging in their legs. So we have a bunch of pre and post images here, but we have very happy patients when they come into us with large, what we call rope-like vessels or varicose veins, and they're left with a nice smooth contour leg that they are proud to wear shorts, especially NorthState. Here's an example of a patient. This patient had multiple children. She had 3 sessions of ambulatory phlebectomies, but you can see the result was to eliminate all of her ropey or varicose veins.
That is just amazing.
So she was very happy.
Yeah, it's definitely one of those things. You look at these, like we always like to say here on NorthState Health, whatever symptoms that you're having, what condition it is, there is help out there.
There's help out there. A good example, this next slide talks about spider veins, and spider veins themselves are very common. Here's the key. They're often a sign of something below, something worse. So we get referrals from some of the spas in town that laser treatments for spider veins occur, but they want to know, is there something below this that can make the spider veins come back if we just treat the surface veins? And yes, there is. However, once we discover the root cause, and that's via the laser treatment or radiofrequency, we can treat the spider veins with an injection called wet sclerotherapy. It's a long word. It basically just means we inject the small vein and we irritate it with a small detergent. And over a period of about 6 weeks, you can see the smooth contours go to basically a nice smooth contoured leg.
That is just amazing. Well, thank you so much for breaking these things down so simple for us. I mean, even with the props that you've been having, it's just, great to
thank you.
Break it down and make it in layman's terms so that we can all understand it. So we're going to be talking about the spine coming up next in our next segment. We have much more still to come, obviously. NorthState Health. We'll be right back, so stay with us.
Watch NorthState Health with host Tim Mapes every Sunday night at 5 o'clock, only on KRCR News Channel 7.
But with ultraviolet treatments and reverse osmosis, I plan to clean up my supply and demand that I have a better taste.
But he's just filtered tap water. Do you really want to pay for that?
Is that true?
Yeah, see,
A boat for me is a boat for pure, natural spring water. I come from a certified spring that's among the best tasting spring water in the world.
Bring real change to your water cooler. Vote for Bob.
Pure and simple, naturally the best. Mount Shasta spring water.
Nothing takes you away like a good glass of wine. The beauty and cool air of the Trinity Mountains is found in every bottle and every sip of Alpenceller's wine. Come and spend a day at their beautiful winery where the tasting is still free. Alpenceller's Winery, open for tours and tasting. Also available at local retailers. Visit alpencellers.com for more information.
Welcome back to NorthState Health. We have been talking with Dr. Thomas Bay of MD Imaging about veins and vein health. Now we're going to switch directions here a little bit and talk about the back. You also work with patients on spinal issues, that's right?
Yes, I do. We do minimally invasive spine surgery, and we work from within the vertebral body or the spine. Our goal, again, is to minimize the amount of incisions that are having to be made. This is an example of a spinal compression fracture or a back fracture. What we see here is the spongy-like appearance is trabeculated bone. When a fracture occurs, there's a flattening of the bone, a wedging, if you will.
Yeah, can you explain that one, the T word that you mentioned? Explain that for the viewers.
The thoracic spine and the trabeculated bone, it's a spongy material. It's surrounded by a hard outer cortex of bone, but it's the reason a bone can flatten. It's a reason why people can lose height. We have a slide of basically what happens with people over the years that have multiple spinal fractures or mild fractures. We all have a great-grandma that just seems to be almost a foot shorter, right? It doesn't happen because grandma's a motorcycle activist and has fallen. She literally is having micro fractures throughout her 60s, 70s, and 80s.
Oh, wow.
And a lot of times because of osteoporosis. What we see here is the same lady transfixed 20 years. That's exactly the same lady. They took a picture of her in her 60s and her 80s. And you can see her height loss, how she's curved forward. And you've all heard of the dowager hump and the kyphosis. These are terms based on the curvature of the spine. And now she's confined to a walker. And I think my next slide shows a little bit of details on impact of lifestyle. This is really key. What we see is loss of height, back pain, depression is very key in this. Patients cannot snap out of depression. Impact on daily living. GI and respiratory difficulties. This is an interesting fact. If you look at the patient's abdomen on these pictures, you can see a protrusion, or the abdomen appears to be getting larger. And in reality, it's not. In reality, the spine itself is shrinking, so her abdominal contents have to go forward.
Oh, wow.
And her height is lost in her lungs, so her lungs are literally compressed. She's not able to deep breathe. And her abdomen is bulging, so it's, she's getting GI disturbances, she's losing the ability and want to eat. So these factors can lead to a serious depression. And what you all see, or what we often see, is an 80-year-old patient has a 60 or 50-year-old son or daughter. They're facing the impact of taking care of their loved one while they're still having their family to raise. So we try to stop this process. How do we stop this process? We do it with minimally invasive surgery.
Yeah, so you were saying that the treatments, and we're going to talk about that coming up in the next segment, but you're saying the treatments, there's something that it can be very quick turnaround, huh?
It can be a very quick turnaround. What you can get is sometimes same day, a patient can be admitted to the hospital and I can have them home 6-7 hours after the procedure, meaning a recovery period of watching them for about 4 or 5 hours after the 1 to 2 hour procedure. And thankfully they're going home the same day. Significant reduction in pain level and stability of the spine is the key.
All right, we'll keep that thought because we're going to talk about that when we come back from the break.
When accidents happen, minutes matter. Count on Shasta Regional's ER for on-time, first-rate medical attention.
I'm the voice of MD Imaging, and as the lead operator, I'm the first person most patients speak with when they call. I think it's important for patients to hear a real voice at the other end of the line when they call in, so that they know that we really care about their call and want to meet their needs. The difference that you'll find the minute you walk in the door at MD Imaging is that the people here really care.
Oh yeah, this is good. Take care.
When accidents happen, minutes matter. Count on Shasta Regional's ER for on-time, first-rate medical attention.
Welcome back to North State Health, the North State's first local health program.
We are back here with Dr. Thomas Bay from MD Imaging, and we are talking about spinal fractures. We're going to talk about the treatment and how actually easy it can be. But what are first some of the common causes of spinal fractures?
Spinal fractures, I'll tell you, the most common cause is osteoporosis. We have an image of a lady here. This is the same exact lady superimposed 20 years in her 60s and in her 80s, and you see she's lost her height there. Numerous small spinal fractures over time can lead to height loss. Why do we get these? Osteoporosis is very, very common, especially in the Western world. What we have, main cause, one, smoking, horrible for bone density. Number two, black sodas, believe it or not, have phosphoric acid in them. Phosphoric acid is buffered by taking our bone density away from us as you drink the black sodas. Smoking, black sodas, coffee, caffeine, too much of anything in excess, too much alcohol in excess, a sedentary lifestyle, couch potato. Uniquely enough, very thin ladies have a higher incidence of osteoporosis than a heavy-set lady. And it has to do with just a physical activity on the bones, meaning weightlifters, very low incidence of osteoporosis. People with weight-bearing exercises. Cyclists, uniquely enough, have strong bones in their legs because of the muscles used, but not so strong backs because of not much weight bearing while they're riding the bicycle. So we see it in different lifestyles. But osteoporosis in general is the main cause for fractures.
Okay. Well, so another reason to hit the gym, I guess.
There you go.
So let's just say, no matter what the cause is, you have it. You are experiencing the symptoms of osteoporosis. How would you treat it?
Okay, treatment is, again, going back to our specialty, interventional radiology, trying to be minimally invasive here. We want to try to find a way to get cement or stabilize the vertebral body from within. Here's a video clip of the procedure we do, which is called kyphoplasty, which is augmentation or inflating a balloon within the center of the vertebral body. Here we have two needles. Sometimes I use one, and we guide the needle into the vertebral body and inflate a balloon. As the balloon is inflated, some of that wedging you see goes away, and also it creates a cavity. When the cavity is created, we can take the balloon out and fill that cavity with a form of cement. The cement we use is similar to what your orthopedic surgeon would use for a hip replacement or a knee replacement. It's a similar type of cement. We take the needle out, and you're left with a stabilized vertebral body. I have a picture of the exact mechanism, but I also have an example here. And what we do is we go into the vertebral body with this. You're left with nothing more. You see the picture there of a Band-Aid or a small incision. So now if we go in with this, I'll show you a picture of this. This is inside the vertebral body here. And what we have is, as I inflate the balloon, you see it filling the center of the vertebral body.
Oh, wow.
So as I collapse this balloon, I'll create a small cavity. This balloon is very strong. The burst pressure of this balloon is 400 psi. And an example, a car tire is inflated to about 35 psi. So we're talking of high-tech materials have allowed us to do this procedure that couldn't have been done years ago before these materials existed.
Okay, so we have the procedures, the materials, and the technology to do it, and then you're also saying the great thing about it is the turnaround time. We saw that photo about how minimally invasive it is.
This procedure is extremely minimally invasive, and by that I mean sometimes you're coming in at 8 a.m., I can do the procedure in about 2 hours, and you may go home the same day, 3 to 4 hours after the procedure. Before it was a week-long recovery or 2 weeks. Here you're home the same day. And nationwide, 85 to 90% of the pain is relieved or completely absent after the procedure.
Okay. One thing that I think people, patients out there, potential patients might want to know about is you were saying earlier when we were talking about the treatment for the varicose veins, I'm not sure if this is the case with the spinal fractures, but you're saying you don't need a referral for at least the varicose veins. So tell me about that, that they can come directly to you.
That's a unique aspect of this field is a patient who has varicose veins, who sees them or aches from them, can come directly to our office and get a screening consultation visit, which usually results in an ultrasound examination to find the underlying cause. Back pain is very common. A lot of times patients will initially go to a chiropractor or a family practitioner to investigate their back pain, get a CT scan or MRI, and then they call us.
Okay.
They can also call us directly if they have back pain.
Okay. All right, that sounds good. Well, that is about it for this edition of North State Health. We are going to take a quick break, 1 minute, and wrap up with our guest, Dr. Thomas Bay from MD Imaging. So stay with us.
We've done it. Owens Healthcare has opened a new convenient location on Lake Boulevard in the old Blockbuster building. Now our customers in North Reading can enjoy our trademark friendly hometown service. Get their prescriptions filled in 15 minutes or less, guaranteed, and do all that in a new convenient location on Lake Boulevard. Of course, we still offer our free VIP home delivery service to anyone for any reason. Stop in and see us. Owens Healthcare.
I have some close dear friends that have a fairly large home. They're on PG&E. They were running utility bills of excess of $1,500. They were empty nesters. Their children had moved on. They were cooling and heating areas they didn't need to, so we put in zoning and installing a more high-efficient system. And we were able to make a dramatic, significant difference for them.
Call me today at Gibson Heating and Air Conditioning, your factory-authorized Bryant dealer.
Well, thank you for joining us today for North State Health. Join us each week at this time for another edition of our show. For more information on our program, go to krcrtv.com/NorthStateHealth. There you will find information on all of our doctors, tips from the experts, and you can watch entire shows from your computer. Again, I would like to thank Dr. Thomas Bay of MD Imaging for joining us this week, and you can join us next week right here on News Channel 7 for another edition of North State Health. And we wanted to clarify something really quickly, though. You were talking about the causes of osteoporosis. We have about 30 seconds. Okay. Black sodas, explain that. What should we look for?
It's unique because not all black sodas have phosphoric acid in them. One black soda that doesn't is most root beers do not have it, and that's why the root beers seem a little smoother tasting. The ones that are a little harsher tasting, I won't name names, but basically have phosphoric acid. It's buffered by your bones, and you will develop osteoporosis with too much black sodas.
All right, so definitely try to avoid those. All right, thank you very much, Dr. Bay.
Thank you.
We will see you next time.